All right. Good morning, everyone. Thank you for joining. We appreciate you taking your time out. I am Brandon, and this is Mandy. If you remember us from the past, we've been known as Team Brandy. And today we are going to talk about your benefits effective April 1st of this year. And I'm going to share my screen here, and we're going to go through a couple slides. And of course, you'll be getting all the information, and this is recorded if you want to refer back to it. Just got a few more here that I'm admitting. All right. Okay, Mandy, can you see my screen?
You're good to go.
All right, you're always my confirmation that you can see.
Oh, I thought I was your corrector. I kind of like to be your corrector.
Uh, Maybe some days we'll allow
Okay.
that.
Okay.
All right, so this is your open enrollment period. If the changes will be effective April 1st. The prior month is always the open enrollment. This begins now and will end on March 22nd. We'll explain what you need to do. There will be some steps for you, regardless if you have no changes.
No,
No, you're going to correct me already. If there's
you guys, I'm just gonna correct you. I am gonna go over what to do. You're going to make any changes through Employee Navigator, but we'll do it at the end, just for, the fun suspense, and the open enrollment email will go out and I'll get all that out to you.
Thank you. All right, so let's talk about the changes in the benefits. Good news and a little bit of bad news. This is kind of our world now, is that we have to deal with a lot of different factors that are going on in healthcare. Most of you probably are aware there's just a lot of issues and challenges that we face. And one of them is the current market where we've had higher renewals and not as, I would say, as competitive competition coming in. And so it's left us with having to make some benefits within the plans. The good news is that we are renewing with Cigna, and we're renewing with the two plans. There are some changes to those plans. It was a tough renewal. I will explain, why. One is because of where we're at in the market, but two, we do have some of our experience in pension plan specialist that goes towards the renewal, and our experience was a little bit higher this year. And it's great that everybody's getting the proper care that they need. So that's good news. But because of the higher experience, it tended to have a little bit of bump in the renewal. And so we had to kind of try to curb some of that increase. The good news, though, is having these two plans still is unique. Most employers are, in fact, going to one plan, and mostly an HSA. That tends to help control the cost. But it was important to pension plan specialists to allow to have that choice. And so here you can see on the slide are the two plans. The costs are going up for pension plan specialists. And again, though, they're absorbing that to allow 100% paid, which is incredible in today's market and environment. We aren't seeing this much anymore with employers paying 100%. So I'm sure right now you're clapping loudly, and we appreciate them doing that. There is some slight changes in the benefits. Most of it is going to stay the same. I'm not going to spend the time to go through these line by line because they are pretty close to the same. I'll just point out a few of the differences. The first is the deductible is staying the same at $5,000. The out-of-pocket is $6,000 individual. And then family is $10,000 and $12,000 for out-of-pocket. The co-insurance is where it's shifting. It was a 90% coverage. You were responsible for 10%. Once you've hit the deductible, that's when the co-insurance comes in. When you satisfy the deductible, the remainder of the benefits are out of co-insurance. So now, once you've hit the deductible, it's 20% you will be responsible for. The plan pays for 80. Now, once you've hit the out-of-pocket, so the co-insurance is in between the deductible and the out-of-pocket. So it's not a whole lot, even though the co-insurance shifted from 10 to 20, the out-of-pocket's the same. So once you've hit the 6,000 individual or 12,000 for family, everything is covered 100%, including prescriptions, doctor visits, all of that covered 100% once you've hit the out-of-pocket max. As a reminder, the preventive care is still covered 100%, not subject to deductible. There's no copay, so we encourage you to go in and get your preventive exams done. We are going to go through a couple scenarios here in a minute to talk about some of the tips that you need to be aware of when you go in for preventive care. The next thing is the HSA contributions. Not only is pension plan specialists paying 100% of the premiums, they're contributing to the HSA account. And again, this is pretty rare. Very generous contribution. It is shifting down a little bit, but there's still a very generous contribution to the HSA. And you can see here the monthly amounts for each year, and then the annual amounts that will be put into your HSA bank account. Now, please be aware there's an annual maximum the IRS will allow. That does include the employer, and so you can contribute the difference of the two, but just make sure you're counting both. And if you are over 55, you can do an additional $1,000. So that's the HSA plan. The local plus choice plan is, here are the costs here. Again, 100% paid. The deductible on this one is going up from $1,000 to $1,500. We needed to make an adjustment there to curb the cost. The family will go to $3,000. And then the out-of-pocket is going from $4,000 to $5,000 for the individual and $10,000 for the family. Everything else in this plan is staying the same. So here again, you have the choice between the two. This is the time now if you want to make a change in the plans to do so. Also, if you have dependent changes, that type of thing, this is that open enrollment period to do it. So one question would be, why would I choose the HSA versus the choice? Well, the biggest thing there is the contributions that would go into the HSA account. I will show a little bit of a scenario if you do this over a period of time. The other thing is if you are getting close to retirement, this is the plan. This is in fact becoming the fastest growing plan because it is the plan you can have in retirement. You can use anything you've saved in that HSA account after you retire to pay for medical expenses and even Medicare premiums. And so this is why this might be a good option.
Brandon, I think there's someone trying to get into the meeting. Can you allow them in?
Yeah, I've got a couple coming through here. I'm doing it as fast as I can.
Oh, okay.
So now we shift to, and if, by the way, if you have any questions, feel free to put into the chat. And Mandy, while I'm presenting, if you'll look at those, and then when you are, I'll take a look at them.
Great.
So now dental and vision, good news here. Everything is staying the same. It's 100% paid again. No changes to the benefits there. So thanks to the leadership there at Pension Plan Specialists. I won't go through these. Just a reminder, those are both with Cigna. So medical, dental, vision, all staying the same. This here is just a reminder of the other lines that you have. There is an FSA. We will go through HSA eligibility just as a reminder, but you cannot contribute to the FSA if you are enrolled in the HSA. This is only for those that are on the choice plan. Dependent care, though, you can elect in that regardless of plan. So if you have dependent care that you need, you can pre-tax those into this account. And then there are other lines that are affiliated with Colonial: disability, accident, critical illness, term life. All of these are on Employee Navigator. You'll be able to see the benefit there. They are age banded, so it does vary by rate depending upon your age, but all of that's available to you on Employee Navigator.
That's right. We do have a couple good questions, Brandon. So let's cover those before we go to the next one. The first question is what percentage of people hit their deductible on average? So that's kind of a good question because the choice plan went to the $1,500 deductible. They were used to the $1,000. So how many people are actually going to be hitting their deductible on average?
Yeah, that's a great question, and that is a statistic that we have always ready to know, because it's important to know that as we raise the deductible. So about 20% of the workforce is going to hit the deductible. About 10% will hit the out-of-pocket. So majority of the people are not hitting the deductible. They're either paying the copays, or if they're on the HSA, more likely they're just doing the preventive and a few doctor visits and prescriptions. So about 20%.
Okay. And then also, what happens if someone moves from the HSA plan and has paid more year to date than the lower deductible plan? So those accumulators they follow you from the plan that you're on. So if you are currently on the HSA and you've paid $2,000 towards your deductible and you move over to this choice plan with a $1,500 deductible, that's going to follow you. But obviously, if there's only a $1,500 deductible, you've already met your deductible then on that plan. So just as a reminder and a refresher, the deductible is on a calendar year. Your plan starts on 4/1. So anything that you've already accrued this year, you're not going to lose just because you change plans.
Thank you for that.
Yeah, good reminder, good questions. Any others before we continue? No. Okay.
I have 5.
Mandy, you got 5. More of grievances. We decided to come up with these because these are probably.
It's right there. It's right there. It would be on my calendar without me.
Christina, mute yourself.
Right. We can hear you.
We've decided to come up with the things that we hear the most as consultants in healthcare. If there's anything probably to get out of this presentation, it's these 5 things. They will come. You will experience them as we do, as we are healthcare utilizers. These are things that we deal with as well. So Mandy, why don't we go through these?
Yeah, let's go through them, because I also wanted to say, when we go line by line through healthcare benefits, we know it's not the most exciting thing in the world, but these are actually practical things that probably will happen to you. And we want to give you the tools to be able to navigate through the healthcare system, which can be challenging at times. So the first one, Brandon, is I can't get into a provider and they're not accepting any new patients. What do I do with that?
Yeah, this is probably the number one thing that we're hearing right now. This is a healthcare industry problem. It's not necessarily specific or tied to Cigna. It's all the carriers. The biggest problem is one, we have a shortage of medical graduates as primary care physicians. Most are going into specialty or surgery, and so we are not seeing a lot of primary care physicians come through. So it's causing a backlog of visits. The couple solutions is one, virtual visits are becoming more accessible. You can get in a lot easier, obviously. And then sometimes you can even get a primary care physician assigned through the virtual and use them until you can get in. We tested out the providers right now, and there is about a 2 to 3 month wait on some of them. So again, if you're wanting to get in, you schedule right away and then try the virtual visits. Mandy, do you have any insight on that?
Yeah, I would just say, and I'm gonna review it a little bit more in a later slide, but using mysigna.com is really helpful because their virtual visits are through MD Live, and you can connect right through your MySigna portal. That is the doctors that we really want you to use. Maybe a PCP that you use does offer a virtual visit, but if they are not in the MD Live network, it's going to cost you differently than it would for a virtual visit. So I just want to use that as a reminder to people. Yes, you can use a virtual visit to, establish, get a primary care, see them one time. If you're having trouble getting in physically to an office, but just know you would use the MD Live network of doctors, even if your normal PCP is in network with Cigna. So they might not be in network with MD Live. So those are just kind of some things to remember as you look at virtual visits.
Okay, good. We kind of covered 5 then. Virtual exams are not the reduced copay, or they're not our primary care physician. That's why if you go through your primary care physician, you're going to pay a higher copay than you would through MD Live. All right, so number 2.
Preventive care exams coded as diagnostic. What does this mean?
Yeah, this is a big one. This happens to a lot of people. You go in, you schedule preventive care exam, and you end up getting a bill that's $200. And the reason why is because your physician changed the coding. Now, Cigna covers the bill as it's coded, right? So this again is not a Cigna issue. They're paying the bill that was coded by the physician, and the physician has changed it from preventive to diagnostic. Then it's no longer covered 100%. Now, some reasons why they may have done that. Number 1, you had a prescription refill. If you ask for a prescription refill at a preventive care exam, it's no longer preventive. It's changed diagnostic. Number 2, they started to ask more questions about your blood pressure. And for whatever reason, they said they thought that was a diagnostic visit. That's another one that has come up. And so, or you've asked them to look at something, the rash, the mole, all of that are reasons they're going to change it. And believe me, they are being trained to change it to diagnostic. So when you go, it has to be clear that you are there only for a preventive care exam. You don't want refills. You don't want any consultative advice on anything that's occurring other than the preventive exam and the blood work that's tied to that.
Excellent. We do get that one all the time. The next one is recommended imaging. When I'm at a provider, it sometimes is expensive, or it may not even be in the network. And my own doctor sent me there. Brandon, why? What's happening?
Yeah, this is a frustrating one. If you're going to a major facility like Providence or Peace Health, Legacy, they want you to use their imaging because it's right in house. They make a good profit off that. So, though, if, for example, you go into your Providence PCP and they want to do an MRI, they're going to send you right there at Providence. You're going to pay 2 to 3 times more than if you were to go to a Quest or LabCorp. Now, you have the right to not have to go to their imaging. You can go to a LabCorp or Quest and get that x-ray. We encourage that. It's literally half the charge, especially if you're on the HSA plan. You'll want to have those costs reduced because everything's subject to deductible.
I do want to jump in here on that though, Brandon, just because I don't want to cause any confusion. They do have a local plus plan. So Providence isn't in the network. So whoever was in the chat, that is correct. Providence is not one of the hospitals that's in the network, but he just referring to usually a hospital imaging is more expensive than one of the kind of outpatient lab centers. So I want to clarify that.
Thank you. And then the network issue, if your provider, your PCP, has recommended a specialist, I don't think that a lot of them necessarily have the whole network memorized, especially when it comes to Local Plus. They're probably not taking the time to look and make sure. Some do, not all of them though. And it is your responsibility as a consumer to make sure they're in the network. It's just one call or mysigna.com looking up the Local Plus network to confirm they're in the network. So what has happened is if somebody hasn't confirmed that and they go there, they're getting a big bill as out of network, and then we're hearing about it. Well, my provider told me to go there. Yeah, we understand, but at the end of the day, they're holding the consumer 100% responsible to confirm it's in the network.
Okay, and the last one, you did cover some of it on the preventive care exams, but preventive colonoscopy that's changed to a diagnostic, this is one we see a lot too.
Yeah,
So,
go ahead, Mandy.
yeah, I love talking about colonoscopies. So yes, colonoscopy is a preventive exam, and they did change the age to that, right, Brandon? What is it now, 45? Your age?
Yes, it is. 45.
So you want to go in and get that preventive exam, you schedule it, you go in, and then maybe they find a polyp and they remove that during the procedure. Well, then that changes from a preventive colonoscopy to a diagnostic. So again, there's nothing really you can do about that. We just like people to be aware, because of course you want them to remove anything that they find that shouldn't be there. Because you don't want to go under again, but that's just one of the things that can happen with the preventive colonoscopy. Makes sense. We have a few questions up here. I'm going to have to apologize because on one of them, Autumn, I don't understand exactly what the question is. It says, so the numbers meeting deductible, are you sharing the copay kind, about 20% met deductible, and not anyone on the HSA? Or do you have a breakout of HSA copay meeting deductible? I think, is this referring to when he was talking about how many people on average meet their deductible?
Yeah, that's what I was wondering. I was wondering, you said something about like, it made it sound like there were not many in the HSA plan that met the deductible, but there were about 20% in the copay kind that did. Is that what you're saying? Or can you clarify the breakout of there? Is it 20% across the board?
Got
I
it.
know it's like backing up to.
20%, yeah. 20% across the board, regardless of plan, tend to hit the.
Do you have the breakout of whether the copay versus the HSA, or not that detail?
No, we don't, unfortunately. Yeah, it's just the standard in the industry is about 20% regardless of plan.
Autumn, what we were really trying to hit home was, yes, the deductible is going up, but the impact is not going to actually hit everyone every year. That's what we were trying to convey with that stat.
Thank you.
Okay, and then there's
All
one more
right.
question, Brandon, on the HSA account.
Yeah, I'll get that here there in a minute. I'll get there in a minute. I
Okay.
see it.
Okay.
So this here is just a quick slide to show the advantages of the HSA. First of all, it's pre-tax. So everything you save into the HSA, you save money on taxes. And then it's obviously a cash reserve for medical expenses. And this is just a comparison of what can happen if you were to save over a period of time. Now, I find this slide a little bit funny because I'm no longer 35 years old. So my time has passed where I can save 30 years. But you know what? It's better late than never. If you're looking towards retirement in the next 15 to 20 years, HSA is probably a good way to go. This just shows you, like the green line there, if you only had an expense of about $1,000 a year, which is kind of low, you could end up saving this amount for your retirement and healthcare benefits. So just an example over a period of time how the HSA can help. Are you eligible? Just a couple of reminders. These come up a little bit. Number one, you have to be enrolled in the medical plan at pension plan specialist to contribute to the HSA, and it has to be the HSA plan. All right. So if you're enrolled in a dependence plan, you cannot enroll on the HSA plan with pension plan specialists. Also, if you are dependent on another tax return, you cannot contribute to the HSA plan. That one there, you can enroll in the HSA plan, but you can't contribute. So I'm not sure the advantages to that. And then if you are in Medicare, and this is where it's coming up more and more, where somebody turns 65, the government loves to make you think that you have to automatically enroll in Medicare Part A. That is not true. You can actually decline. Many are declining so they can continue to contribute to the HSA. If you do end up enrolling on Medicare Part A, you are no longer eligible for the HSA. So if you're close to that age, pay attention to that. And if you're wanting to remain on the HSA, decline Medicare. TRICARE is another one that you are not eligible for. And then we talked about the FSA is only applicable to the choice. Here's a couple limits that we've already talked about. 4,150 for individual, 8,300 for family. And then if you're over 55, you can do another 1,000. So here are a couple other things to make a contribution, maximum contribution in the calendar year. You must be enrolled in an HSA plan. Obviously, we're changing now for April 1st. If you were on the choice plan and you come on the HSA plan April 1st, you are eligible for the full maximum contribution. The IRS does allow that. Even though you were on the other plan for 3 months, you can still make a full 12-month contribution. If you had an FSA, though, on that choice plan and contributed for the first 3 months, you do need to minus that out from the full contribution on the HSA. So hopefully that makes sense. Now we have a question here on HSA contributions. If I had dental work that exceeded my HSA amount for 2023, can I finish paying the 23 bill with 24 HSA? There's two answers to that. The first answer, by the book, no, you can't. It has to be contributions made in that year to pay for expenses that year. Technically, you could, and I've never seen anybody audited for that. That would be a tough one. I will tell you, it probably happens all the time by consumers. The IRS is probably not paying attention to that, but if you're by the book, then no. I'll leave it up to you.
You're talking to a group
So,
of accountants.
Yeah, they're
yeah, I get it, right? I know who I'm dealing with, so that's why I said by the book. What about HSA grievances, Mandy?
Yeah, let's talk about that. So there are some different grievances when it comes to learning how to navigate an HSA plan. And I know you guys have been on an HSA plan for some time, but for some that aren't, here's some of the things that come up. I must pay for my whole prescription. What does that mean, Brandon?
Yeah, number one issue with an HSA, again, everything's subject to deductible. I go to the pharmacy and the drug costs $300. I'm paying the whole $300 until I hit my deductible. That's usually the biggest wake up or awakening, is that you're paying for the whole thing up to the deductible.
Okay. I don't seem to have any benefits. How come that seems like that when I'm on an HSA plan? What does that mean?
Yeah, most of the time, if people enroll in the HSA and they didn't pay attention to the meeting, are going to find out that they are paying everything to the subject to deductible, and it doesn't seem like you have a plan. And the reason why is the IRS requires everything subject to deductible for the pre-tax savings. So HSAs, again, are a great way to go, but just be aware upfront costs are an issue with HSA. Now, a good thing with pension plan specialists that a lot of employees don't have at other companies is that you've got HSA contributions coming in to help pay for those expenses until you meet the deductible.
That's right.
Number 3, we've already talked about, so we're good there.
Number 4 comes up. I can't get any help on my banking issues with my HSA bank account. Can I have Tiffany just do it for me?
She can't. It's a federal regulated bank account, and so this is private between you and the bank. There's nobody that actually can help with the banking issues except for you, unfortunately. So if you have questions about the fees or a debit card or that type of stuff, you will need to be the one that calls HSA bank to deal with it. And then
Okay.
5, we talked about virtual exams. Just be aware that under the HSA, there is a requirement there by the IRS to make it a higher cost. It's not necessarily going to cost you $200 or $150 if you went in person, but it's going to be higher than the choice virtual copay.
I went a few weeks ago. I didn't go. I had a virtual visit a few weeks ago. It lasted 3 minutes and it was $398. Just so you guys know.
Because you're on the
Wow.
HSA plan.
Exactly.
Yeah. That seems high.
It felt high, but I had thrown out my back and I needed some help.
Yeah. Now, I would just add to that, Tiffany, was that the actual bill from the doctor or Cigna after
Doctor.
they apply okay, so they'll apply the discounts, right? So there is discounts that Cigna has with those providers, and so the net should be lower than that.
No, that was my cost.
That was your cost even with discounts. Wow. All right, so Mandy, I think
Yeah.
I'm done talking for a while, unless we have some questions.
Okay. So I was going to cover the mycigna.com. Again, you aren't new to Cigna, so I know most of you have registered here. And if you haven't, I would suggest that you do, because there's a lot of great things that you can do on mycigna.com. Oh, I'm going over the wrong slide. Excuse me. I apologize. First, let's talk about virtual visits. We have touched on it a little bit. And you can get on your virtual visits through MD Live through your mycigna.com. So that is a great thing. As a reminder, you can have minor medical virtual care. There's a lot of examples listed here on this slide, just for a cold, flu, headaches, things like that, something minor. You can use a virtual visit for that. And in some instances, it's cheaper. As Tiffany explained, sometimes it's not. Just depending on what plan you're on, but just as a reminder, this is an option for you. And you can also use it for behavioral and mental health virtual care. So I do like to remind people that they do have that benefit, and you can speak to licensed counselors or psychiatrists, and they can diagnose, treat, and prescribe most medications for non-emergent behavioral health issues. So that is something that you can use the plan for as well. Again, when you get on mycigna.com, you can use the MD Live through your myCigna. If you go to the next one, this is when I really wanted to do my commercial for myCigna. And again, you guys have had Cigna, so I know that you can do a lot of things there. But as Brandon was saying, sometimes you get sent to a hospital for some imaging. You actually could go on mycigna.com and you could get cost estimates for different procedures with different providers. And so that's a great tool to use if you're looking to get the most benefit. And because you're registered here, it knows what plan you're on, and it's going to kind of give you these estimates based on you individually. So that's a great way to use it. You can also manage and track your claims through there if you need to see what your accumulators are at, how much of your deductible you've hit. You can see all that information there. As a reminder, you can view and look at your ID card. Cigna doesn't send out an ID card any longer. They're only going to do digital ID cards. So this is kind of a must for all of you so that you can access your health ID card that way. Is there anything I missed on that one, Brandon?
Did you go over just if you have a medical procedure, colonoscopy, MRI, that you can check it see the costs in the different facilities?
Yes, the cost estimator tool. I did. Yes, that is. Yep. Thanks for listening. Okay, so on the next slide.
Well, we got some questions here. I was reading.
Do we need to stop for those before I go to Employee Navigator?
Yeah, let me tackle these questions here. Is it cheaper to sign up for home delivery prescriptions via Cigna? Well, the home delivery prescription is Cigna. They own the system that delivers it to your house, but mail order will save you a little bit, not a whole lot.
It's for
But you can get convenience and up to 3 months supply for the mail order. So I do heavily encourage that. In the past, I was told if you don't do a lot of medical visits, then the high deductible HSA is the way to go. But if you do a regular visit or a health issue that requires more doctor visits, you should go the choice plan. Is this still correct? Well, first, yes. If you don't have a lot of medical visits, then by all means, the HSA is the way to go. You've got your preventive covered 100%. If you only have low-cost generic prescriptions, those are not too bad. You've got contributions there from pension plan to pay for those things. So yes. The debate is if you are a high utilizer, sometimes the HSA is still a better way to go. You've got an out-of-pocket there of $6,000. The choice is now at $5,000. So you're only ended up paying $1,000 more in the out-of-pocket on the HSA, and you get the HSA contributions. If I were a high utilizer, I would probably still pick the HSA. It's kind of in between there where you may want choice. If you've got some higher cost prescriptions, maybe a procedure or two that's coming up and you're not going to hit the out of pocket, then the choice is probably the plan. Okay. She's saying, how do I see my dental insurance for the year or utilization? I wasn't able to find that on my Cigna.
You should, okay, so it should have your dental information there as well. So that
I
would
just
be,
sent Christina a screenshot of how to filter it to get dental versus medical.
okay, yeah, there's some sort of filtering that you have to do to get to the dental screen.
Yep, on the left-hand side of that screen, you can say who it's for, what sort of claim it is, pharmacy, vision, medical, dental, and it'll give you up to the custom date range or the last 24 months.
Perfect. Thank you. Okay.
Just one last question, kind of thing that does come up is the hidden provider. When you're having a procedure, it's come up in the past where you're having a surgery and they bring in somebody, if it's an anesthesiologist or specialist that comes in and they are not in the network. This does happen. A few years ago, they did change that so hidden providers are covered. I will still say that it tends to come up and we have to reprocess it. If that ever is an issue where you get a procedure bill and there is something in there that's being not covered as in network, definitely reach out to Cigna first. If you're not getting the answers that you need, then you come to us and we will have it reprocessed as in network. Okay, Mandy, now we can talk about your great employee navigator system.
Thank you. I know everyone's on the edge of their seat. It's kind of the best part of the meeting because it's almost over. So this is the employee navigator slide. I hope you like it. As a reminder, you guys use Employee Navigator as your benefit platform, and you can go in and update and make any changes right now because it's open enrollment. This afternoon, around 2 p.m., you will receive an email from Employee Navigator. And you can click on the link and you can log into your Employee Navigator account and you can review what you have. If you want to make changes, do that. If you are somebody that is just going to keep everything the same, you don't need to do it. It's not a requirement. If you don't go in and do anything on that, we're going to just assume you still want your HSA plan or you still want your choice plan, and it's going to renew for April 1 on the new plans that we covered today. So it's not a requirement, but I always suggest people to go in there, see what you have, make sure your dependents are in there. If they're covered on the plan, make sure it all looks right. The FSA, if you want to make new elections, you have to do it through Employee Navigator. It doesn't just assume the same election. So the FSA piece is really important. If you're somebody that's on that plan, we can't just roll those elections over. Those are the elections that actually need to be updated by you for this 4-1 plan change. I think that's pretty much it. You walk through, it's very easy experience. I know you guys have done it before. You make your benefit selections. There's confirmation of everything you chose, a summary at the end. You can see how much your deductions would be if you have any. And then you just review and confirm, and you are done. So we want to just remind you, it's going to go out this afternoon, that email. Sometimes that does go to junk email. So if you are somebody that didn't receive it, make sure you check your spam folders and things like that, because it can get lost. And the email comes from Employee Navigator, not from us and not from Pension Plan. So we encourage you to get in there and review everything. The closing date of this will be March 22nd. So we want to make sure that if people do make changes and updates, we get that over to Cigna in time so that you're ready to go for the 4-1 effective date. So please make sure if you are going to make changes, you get in there and do it. And I think that's all I know.
All right. Well, we have one last question. Is there any information changing on the ID cards?
Yeah, because on one of the plans, there's a different deductible, and it usually has the deductible there, co-insurance as well. So the ID cards will look different, but again, you can access that 4-1 in your MyCigna. So I would encourage you, if you haven't registered there, to make sure you do and download the app on your phone so that you have it and can share it with providers, family members, anybody you need.
If we want to change the amount we are contributing to the HSA, can we do this through Employee Navigator?
That's a good question, because I know Tiffany would track that. Is that where you capture the data for that, Tiffany?
Yes, all of it goes through the navigator so that it's all in one place, and we're done with paper forms, which makes me happy.
No paper, no paper. Yes, that was a great question. If you're doing a different HSA contribution, make sure you update that in Employee Navigator.
Can medication not be covered by Cigna be able to be purchased with HSA money? Yes, absolutely. You can use that for prescriptions. I would just say, use GoodRx too, the app. That has a lot of discounts there that you might be able to use for your prescription. Just be aware though, if you're using GoodRx, that it'll not bill the insurance, and so it won't go towards the deductible or the out-of-pocket. So if you're trying to hit the deductible out-of-pocket, you'll need to have it go through Cigna. If you're not, then try GoodRx, but you can use HSA dollars for either one of those.
And then Debbie had a question that I think might have gotten missed. Is there any information changing on the ID cards?
Yeah, there will be, because your deductible's changing on one plan. There's co-insurance changing. So your ID card will have some little tweaks to it. So again, go to MyCigna, make sure for 4-1 you're ready to have your updated ID card.
Mandy, were there any changes to the colonial rates, or are they staying the same?
Those are age rated, so those are individually based. And so again, if you're jumping up an age band, there could be a change there, but that is something that you can also do through Employee Navigator.
I just received a report from them earlier this week, so I will let anybody know that rate is changing in April so that you're aware that they're minor. It's just because you moved to a different age tier.
Congratulations.
Long-term care, unfortunately, we are not the consultants on that one. So if you have questions about long-term care, Tiffany, you want them to come to you?
Yes, send me a message and I can give you the contact information for Allstate. That is the only benefit that is not covered by this group right here.
Okay. Can dental offices change to out of network without notice? Yeah, that happens a lot. In fact, it's happening more and more. So, and again, this is an industry issue, not necessarily tied to the carrier. There are a lot of dentists who are no longer accepting carriers. They've canceled United, Cigna is one now. So if that does happen, usually you'll get a notification, but sometimes you won't, and you'll just go and find out it's out of network. They should be somewhat ethical though, and let you know that they're not taking your insurance anymore. They have your insurance on file. So hopefully they're telling you when you make a visit that they're no longer contracted with Cigna. All right, any last questions there? Doesn't look like it. So I think we are done, Mandy. Thanks for everyone joining,
Thank
and
you.
hope you have a great day.
Bye, everybody.
Thanks, everybody. Bye-bye.
Bye.